Welcome back to Cablevision's Hudson News Edition. I'm Sherry Carabin. Tomorrow marks the 6th anniversary of the World Trade Center terrorist attacks. For some people, the anniversary will bring back vivid memories of the tragedy, causing distress. Joining me now to talk about ways to cope with the problem is Dr. Gabriel Kaplan, Executive Director of Behavioral Health Services at Hoboken University Medical Center. Thank you for being here.
Thank you for having me, Sherry.
Now, it's been 6 years. How much of a problem is this anniversary going to be for people?
Well, as you know, when people go through a traumatic event, people have all kinds of symptoms. They have difficulty sleeping, they have depression, they have lack of appetite, anxiety, stress. They have all kinds of reactions to a traumatic event, and that is something that happens because the body is attempting to heal and to cope, and it releases some substances that actually do that, but in the process can actually create these symptoms.
Will it be worse for some people?
It will be worse for some people. As a matter of fact, when people have these kinds of symptoms, some people, the majority of them, resolve these symptoms without any help. For other people, the symptoms go on to become what's known as post-traumatic stress disorder, PTSD. And PTSD can be acute if it lasts only a few months, but in severe cases it can be chronic and become a long-lasting life problem. Now, right after 9/11, there was a lot of concern about PTSD, and in fact there was a survey done by Stanford University where the incidence of PTSD increased significantly, went up to 7.5% New York City-wide and 20% in areas adjacent to the World Trade Center. However, a follow-up survey determined that within 6 months, these rates had gone back to normal, so that it was a very intense acute experience, but also within 6 months, it passed. Now, it's important to differentiate post-traumatic stress disorder from something that is normal, which is called the anniversary reaction. During the anniversary reaction, some of these symptoms might come back, but they're only temporary. And this has to do with
when you say temporary, a day, 2 days?
It can last a few days, and then for most people, these symptoms, again, will resolve. However, like in PTSD, if these symptoms persist for some reason, it'd be very important that the person seek mental health treatment.
What kind of options will they have in terms of treatment?
Well, the options have to do with psychotherapy. They have to do with medication. And again, these will be only a few of the people affected. Fortunately, the illness is not very common. Now, there are some things that we can do with the general population to try and minimize the anniversary reaction.
Such as?
And in general, there are common sense techniques to try and decrease stress. So, for instance, it's important, number one, sleep well, eat well, exercise, get a massage, communicate with people, talk to friends, talk to family, express your feelings, don't hold them back. Very important that you try not numb your feelings with alcohol or drug, because this will make it severely worse. It is also very important that you refrain from watching too much TV. We'll see a lot of articles and news.
That was going to be my next question.
Okay. And the issue with that is that that can bring back some memories, especially for children. If children are watching, it's important that you explain to them that this is a movie, that we're safe now, and this is something that happened in the past. And it's very important that people put this in perspective, that generally the symptoms will resolve, and one try to take care of oneself during those days, and generally the difficulties will go on their course and people come back to their normal type of life.
But if this doesn't happen, they should seek treatment.
They should seek treatment, because when PTSD is severe, it could lead to severe depression, to flashbacks. The possibility of suicidal feelings is also very, very much there. And there are some effective medications that people can take, always under the care of a professional mental health.
Well, thank you very much for joining me here today to talk about this important issue.
Thank you very much.
And if you would like more information on coping with the tragedy, you can call 201-792-8200. And don't go away, because we'll be right back.